I've got off most of my medications and it's doable, so get started.
Thank you, Madam Ko, for joining us today and speaking to us about your journey and where you've come so far. So tell us, how many years have you been on medication?
I have been on medication for about 5 years.
I see. And when you were diagnosed, what types of medications were you taking?
I was put on metformin. In the beginning, it was 500 milligrams, and then as the readings got worse, it was increased to 850. At first, 1 tablet a day, and then increased to 2 tablets a day.
I see. And as time went along, did you find it harder and harder to control your blood sugar numbers?
Well, the readings, the blood HbA1c readings at the hospital that I was going to, they take it once every 6 months, and to my horror, it was going up every 6 months. So, in that sense, yes, it was getting more difficult to control even with medication.
I see. And just as a reference, what was your highest HbA1c level?
7.2, I think.
I say, well, that's not too bad. I've had patients who had worse. Okay. Apart from your medication, diabetes medications, what other medications were you on?
I was also on cholesterol medication, Simvastatin, and blood pressure medication.
Now tell us, how many months have you been off your diabetes medication?
5 months already, I think.
So how's it going for you?
I think it's going very well. The readings are quite consistent. And last HbA1c test, the readings are down to normal level.
I see, great. All right, so was it hard for you to transition from a standard Malaysian diet or the diet that was prescribed to you by the dietitians and making the switch into a low carb? Was it hard for you to do? Was it something very challenging for you?
I think in the beginning, when we first started, looking at what needs to be done, looks like, whoa, everything also cannot take, But I think as you go into the diet and slowly progress, I found that it's not so difficult after all, because in the allowed foods, there's a great deal of variety. There's a lot of interesting recipes out there to try, and no shortage of spices, flavoring. So in hindsight, after doing the program for these many months, I find it's not too difficult to do. When I started the program, it was out of concern that the readings were getting worse and worse. And actually what set me on the journey was a very good friend who unfortunately had a case in the family where her close relative had diabetes and then had a lot of complications. And when she heard that I had diabetes, she was very concerned for me. So after talking about all the horrors of the things that could happen, that was what got me started. So I did not know that it was possible or not possible, but I think what I certainly wanted to do was to give it a try, because I don't want to go down the slippery path of all the horrific complications that she had, that we were talking about.
Do you think it's difficult maintaining your current lifestyle, and do you think it's something that you will stick by till the very end?
I think it wasn't a difficult start, and I think what made it easy was that it was a gradual process. It was not like overnight, you could cut everything out, or overnight you got to change your style of living. Because it was done over time, you kind of gradually get used to it, and now it has become kind of a normal thing to choose the kind of foods that are more suitable, go for exercises and things like that. And because it was done gradually, I think I would be able to sustain it over the long run, because it's become part of what I do every day.
And now that you are able to maintain your sugar levels post meals between 5 to 6, that's your sugar readings, and also reducing your blood pressure medications and coming off your cholesterol pills, do you think there's something very hard to handle at first? And the guidance that was given to you, do you think there was a very clear process?
I think it was a clear process, yes. More than that, I think it's a very critical part of the process, because I realized that I had to do something even before I started the program. And a lot of this information is available on the net. You can Google and all. So I have tried to do it myself. However, without the constant monitoring that the doctor gave and the feedback and the doctor's advice on how to moderate things, how to make a change, I don't think I would have been able to do it. Now in hindsight, I think that was one of the critical success factors.
That's great. And when people say the older you get, the harder is it to adapt, what do you say to those people going into their latter stages in life? Is this something very difficult to adopt for somebody who's older, somebody who has less understanding about their disease?
I would say, in fact, the opposite. Because with age, I would like to think comes wisdom. So we have the time to, I think, do the research. We have the time to consider what needs to be done. For me personally, I'm retired, so I have the time to go look for nice recipes. I have the time to make the kind of foods that will be, beneficial for me. So as you grow older, no, I don't think it is, more difficult for you to get started. Actually, I think you have more time on your hands, more leisure. It's an easier time to get started.
Okay, on a personal level, what do you think the changes or the biggest changes you have seen in yourself over the past few months?
It's a feeling of more in control of what I want, because when the readings were running away, you were kind of all lost what to do, with a lot of stress and anxiety about what's going to happen next, And I think as we grow older, we would like to remain active and healthy. And this was one of the ways for me to achieve that. I think in a Malaysian setting, a lot of people don't really understand what the disease is about. Generally, we know it's about food. But what is it that we need to know about what kinds of food? I don't think it's clearly understood. And I think, unfortunately, many of the medical practitioners don't really have the time to keep close monitoring and to give the appropriate advice in a timely and consistent manner. So in that context, I think there's a lot of room for improvement.
What would be your message to people who are out there, diabetes patients, hypertensive patients, who are seeking to go into a different lifestyle or trying their level best? Do you have any message for the people out there?
From a personal perspective, my message would be that you really need to do something about it if you have diabetes. And the time that you need to do it is today, because it's urgent, and especially as we get older. And yes, there's a lot of information, on the web and things like that, and most people know how to Google. But doing it on your own, I think, is a long and difficult journey. There may be some who can, but I would strongly urge that you should get into a proper program where there is a proper process and a good medical officer who can advise you on a frequent and timely basis. because only if you get into a consistent process like this, can you, move into a lifestyle that will help you to control the disease and to stabilize and continue to maintain that state.
Okay, thank you for joining us today, and your feedback is absolutely incredible, and I'm so happy for your progress. I'm looking forward to many more months to see you progress even further.
Thank you very much.